After menopause, the relationship between obesity and cancer risk in women becomes particularly dangerous. Estrogen levels, which naturally decline during menopause, are no longer primarily produced by the ovaries. Instead, fat tissue becomes the body's main source of estrogen. For women with obesity, this shift has significant consequences, especially when it comes to hormone-sensitive cancers like breast and endometrial cancer. The more fat tissue present, the more estrogen is produced, and this prolonged hormonal exposure can fuel the development and progression of malignant tumors. Postmenopausal breast cancer is strongly influenced by this hormonal environment. Estrogen promotes the growth of breast cells, and when levels remain elevated due to excess body fat, the chances of abnormal or cancerous growth increase. Studies have consistently shown that women with obesity are more likely to be diagnosed with breast cancer after menopause, and those who do are also more likely to have tumors with more aggressive characteristics. Worse still, obesity can reduce the effectiveness of certain treatments, such as hormone-blocking therapies, making cancer more difficult to manage. Endometrial cancer risk is even more closely linked to obesity. In fact, it is one of the most strongly obesity-associated cancers in women. Estrogen stimulates the lining of the uterus, and without the balancing effect of progesterone, which also drops after menopause, the endometrium can thicken excessively. In women with obesity, this imbalance is even more pronounced. The risk of developing endometrial cancer can be 2 to 4 times higher than in women of healthy weight, and the excess risk climbs further with increasing BMI. Obesity also triggers chronic inflammation and insulin resistance, both of which can promote cancer growth. Inflammation damages DNA and creates a biological environment that favors tumor development, while elevated insulin levels stimulate cell proliferation and can contribute to the survival of abnormal cells. Together, these factors amplify the hormonal risk and make the body more vulnerable to malignancy in several tissues, especially those already sensitive to hormonal changes. The challenge is not just biological, but systemic. Many postmenopausal women are unaware of the connection between weight and cancer risk. Public health messaging has often emphasized cardiovascular disease or diabetes as obesity-related concerns, while the cancer link remains under-discussed. This lack of awareness delays prevention and screening, especially in older women who may assume their cancer risk has declined after menopause. Efforts to reverse obesity after menopause face unique obstacles. Hormonal shifts can make weight loss more difficult, metabolism slows down, and physical limitations may increase. As a result, many women find it harder to shed excess weight, even when motivated to do so. Standard weight loss interventions may not be as effective, and without specialized support, many women feel frustrated or defeated. Furthermore, societal stigma around aging and body size can discourage open discussion or discourage women from seeking help. Ignoring the elevated cancer risk faced by postmenopausal women with obesity is a grave mistake. Not only are the biological mechanisms clear, but the consequences are deadly. These cancers often progress silently and are diagnosed late, especially when regular screening is skipped. Without early detection and intervention, survival rates drop and treatment becomes more invasive and costly. The warning is clear. After menopause, obesity becomes a potent, modifiable risk factor for 2 of the most common and deadly cancers in women. Addressing this risk requires far more than telling women to lose weight. It demands targeted education, accessible healthcare, long-term support, and a shift in how society understands both menopause and obesity. Without such efforts, many women will continue to face an increased risk of avoidable suffering and early death from cancers that, in many cases, could have been prevented.